Hi, this is Zac Kulsrud, and I'm here at Chicago Midwinter 2018, where I had the chance to catch up with Dr. Stephen Daniel. Dr. Daniel is the president of the AAP, and we talked about a few things. The first was a world workshop that the organization took place in last November with the European Federation on Periodontology. The second was a first ever best evidence consensus on lasers and CBCT that the organization is pushing out. And finally, looking ahead to see what the organization is doing in 2018. Let's take a look. So Dr. Daniel, last November, you, the AAP, met with the European Federation on Periodontology and had a meeting. Tell us a little bit about that.
We call that the World Workshop on Disease Classification. Mm-hmm. About every 20 years, the last one was done in 1999, the people from around the world that are periodontal educators and researchers will get together to basically update how we define and how we describe periodontal disease and the associated other diseases and conditions associated with that. This time we included peri-implant diseases, peri-implantitis and peri-implant mucositis, which was not covered in 1999. And so for 3 days, about 130 educators got together. There had been papers that were prepared ahead of time. They worked themselves through the paper, added things, subtracted things, argued about things, had some great discussions. It was really something to be a part of. And right now, they're writing consensus papers about all that has come out, and those are going to be published probably in May or June in the United States in the Journal of Perio and in Europe in the EFP's journal.
So give us, the audience, a little bit of context about why this meeting is so important and what it adds to the profession.
Actually, as you can imagine, as any kind of medical or dental technology, we learn as we go. We're constantly adding to our database about, for instance, what causes periodontal disease, how it actually does what it does, what are the best ways to diagnose and treat the disease, just to talk about periodontal disease. With dental implants, now we're learning that dental implants can also become infected. They can be lost because of infection and disease. And obviously, we want to learn how to either prevent those problems from happening so that people don't lose teeth or lose their dental implants, and also how to manage it and treat it if it becomes a problem. And so this is an opportunity to update the verbiage that we use to talk about these. It's a guide for how dental students and postgraduate students in periodontics are treated. The educators use this as a guide. But what's different this year that we did not do in 1999, besides including implants, is we have a translational element built in, because we wanted to take this material and be able to put it into the hands of our members who are clinicians. And so trying to say, well, how can we take what we've learned at the cutting edge of periodontics and put that in the hands of our members so that they can actually take that information and apply it to the patients that they treat in their offices. So that's why I'm so excited about it.
Well, speaking of, the profession is always learning, things are advancing. The AAP recently published something about CBCT.
Correct.
And best practices in that regard. Tell us a little bit about that.
We developed a concept called the Best Evidence Conference, and the first 2 of those were done last year, one on CBCT and one on the use of lasers in the treatment and management of periodontal disease. The topics that we studied in the World Workshop are ones where people consider that the science is mature, that
Right.
we can look and say, this is pretty much what it is today. The topics for the BEC are 2 things. One, that's where they're relatively new technologies, and so the science is not yet mature, but they're of great interest to our members. I mean, lots of us, including my wife and me, use CBCT technology. Many of our members use lasers of one sort or another in their practice, and obviously they want to know how to use it in the most effective and efficient ways, and or whether this is a purchase, an investment that they want to make in order to improve the ability for them to take care of their patients. That's the gap that the BECs are intended to fill. The CBC data was, I'll tell you a little bit about how it works. We gathered a small group of experts And we gave them 3 or 4 focus questions all about the use of these technologies and asked them to address those to the best of their ability based on the evidence that we have. And that's what the consensus paper that was published on CBCT in October is about. The one on lasers will be published, I believe, in June of this year in our journal. And by the way, that CBCT paper is available to anyone who wants to look at it. All people have to do is go to perio.org. You can find it through the menu, and you don't have to be an AAP member to access that information.
Okay. So obviously you've got a lot going on, but as president, you have your eye on certain initiatives that you want to focus on the remainder of the year and for the rest of your term. Can you tell us a little bit about just what we can expect from the AAP looking forward here in 2018?
Well, this year will be consumed with rolling out the data from the World Workshop, because we actually appointed a separate committee to oversee the rollout of that data and to make sure that our members can put it to use well, to answer any questions that may arise, for instance, from third-party payers about how the definitions of periodontal disease are how it's described. So we want to make sure that that transition is very smooth. One of the other things that we have been talking about, in fact, we were just had a discussion about it at our board meeting earlier this month. In 2003, the AAP partnered with the Centers for Disease Control, and for the last 15 years, we've worked with them, Dr. Paul Ecke and his crew, to determine prevalence of periodontal disease in the United States. They actually have it down to county by county, and what we know is that 47% of adults over the age of 30 in the United States have periodontal disease, not gingivitis, but actual periodontitis, meaning the loss of supporting bone around the teeth. And also, untreated periodontitis is where a disease that can have impact on our health in terms of increased risk of cardiovascular events. It compromises the ability of a patient to deal with diabetes. It can compromise and cause premature low birth weight babies, among just a few. And therefore, it's a significant healthcare problem for the United States. What Dr. Ecke and his crew asked us to consider when we met with them in Atlanta at the CDC in October was, could we begin to shift the focus from prevalence to some sort of intervention? In other words, what can we develop in terms of strategies to say over the course of a generation, reduce the incidence of periodontal disease from 47% to say 30%. We managed to do it with smoking.
Right.
And so why not? And we're very excited about that. And our board is now considering how we want to go forward with that. But I'm just very excited about the prospect of us partnering with CDC to do that. It's right in the wheelhouse for periodontists, because we're happy to treat people's periodontal disease. But if we can keep people healthy, either after we treat them or even better, intervene before they ever have a disease, that's the best.
It's very exciting work being done. If people want to find out more and follow this as these stories develop, where can they go?
www.perio.org. We have a section there. It's for public and for our patients. There's all this information is there.
Great. Dr. Daniel, we really appreciate your time today. Great seeing you.
It's my pleasure. Thank you.
Great. Thank you.